Good morning, I think. Morning. So welcome this morning to the RCNI launch of Breaking the Silence, Terminology and Definition. Goodness, I've forgotten the full title of it. The technical document, which is the Terminology and Definition Guidelines for Sexual Violence Against Children. You're very welcome this morning. And I wanted first to just tell you what the structure is. We are recording, but we'll be mostly speakers. But I would invite you as we go along, if you wish to put anything in the chat, we will try to address the questions in the chat as they come up. We'll share with you the resources in the chat as questions arise, and we will try to get to all of those. Elaine Mears from the RCNI, who led on this project, will be in the chat doing the work there. We may hear from her later as well. The lineup, I will outline a little bit of the findings for you and a little bit of the rationale and how we got here in terms of this document, but really we're here to hear from the speakers who were given this document in advance of this launch to consider it and to think about how this document works to support us in combating sexual violence against children, in the prevention work, and in terms of how we work collaboratively in that space, and in terms of our legal obligations, both domestically and internationally. So we're really delighted today to have a number of really key speakers and thinkers on this, people who've been doing the work on this for very many years. And indeed they're colleagues in this work with us for very many years. Unfortunately, the Minister for Children, who was first up to speak, has been called to a cabinet committee, but we do have a recording from him, which we hope to play for you if the technology stays on our side. And then I'll be introducing the Ombudsman for Children, Neil Muldoon, and after that, the member of the Grevio Committee, Biljana Brankovic, and I'll introduce her in more detail when we come to that. But first off, I want to outline for you broadly what we're doing here. I would not be the expert on this. Elaine Mears in our office is the person who put this together. But I think there's something about how we translate this, how we understand, because this is a rather technical document, and it's a technical piece in terms of as a reference guide for people in working on data and collecting data. Why does this matter to all of us, and how does it translate into our everyday lives? I can start the story here. I think we all got very involved in data probably over the last decade. There was a particular, a stampede, if you like, to get ourselves in data collection systems, and the RCNI we're an early starter in that. And we had a partnership with an IT company, and we still do, and it's a really valuable partnership where they've given very generously and for free of their time over the years in a sustained manner to support this work for us. And I think that's where most people started in terms of data collection, and where we think about data collection is that we think about the software. And what we saw over the decade was that it generally started with someone in the IT section, if we were big enough to have an IT section, got given the job of building a database. And of course, all we were talking about there was the piece of software. And it turned out that that wasn't the most important thing about a database. Vital as it was not the thing that made a database work and an information system work. And it wasn't even for us, because you would imagine then, well, the most important person in our database, if I take us as an example here, is the person who currently, the role we have, which is currently occupied by Elaine Mears. She is essentially our oracle. She has her hand on all the levers. She turns every number and every word and every box and the millions of boxes in a database that it makes up a database. She turns that into the statistics and the narrative and the story we can tell publicly that will then change and transform policy and inform how we go about preventing and responding to sexual violence against children. But she's not the most important person either, because the most important person, it turns out, is the person who's not actually doing data, is the person right at the front line who's engaging in some sort of relationship dialogue, service delivery to the person who is about to become and is about to be invited to become the data subject within our database. And they are the people who are at the front line. And for us, that's people in rape crisis centres. They may be delivering counselling. They may be the volunteer accompanying someone to a sexual assault treatment unit or the Barna House unit in this instance. And any other array of the types of services that a rape crisis centre will offer to survivors. And what it turns out we need is for every one of them to be a little bit passionate about data also. And that is the really vital part about a database and a functioning database that delivers the really coherent voice of the survivor right through to the policy level. And that's what a database is for, is to bring that voice through. And of course, there's a few principles here. One is that they are not in the business of collecting data. They're in the business of meeting that person and providing the service that they're there to provide. They're there for access. And so the data collecting business can never get in the way of that work. So the question for us is, how do we support those people? Well, in the RCNI, we very quickly, we gave them job titles, and we gave them a job description, and we gave them a training program, and we built them a network. And that network is one of the most important things that Elaine supports. And that network is all about conversations about what words mean, what definitions mean, how different people use different words and different definitions, and straightening out and making sure that we have an agreed and common set of definitions and words that we use, so that we're all speaking about the same thing when we're looking at the same thing. And so that journey is something that we've if you like, well worked within the RCNI. But when we look at sexual violence against children, one of the things we really notice is that there are a lot of people delivering and encountering those children at different stages, offering different types of services and interventions to those children. And what we need is for all of us to be sharing our language and to be having that same conversation we have across rape crisis centres participating in the RCNI database. And we need to expand that. So when Elaine saw the What Works grant within the Department of Children, she applied for it. And we pulled down that piece of research, a piece of funding, and we conducted this small piece of research. This was a very small and quick piece of research. And what happened first was, one of the most important pieces around this is that every organisation that we identified who were encountering and interacting with these children in some way, shape or form, came on board and really engaged with this project. And normally in these circumstances, I think one thanks those organisations for their cooperation and collaboration. But the fact is that the collaboration was something that they owned and that they fully engaged with. And really, it's not, it doesn't feel like something that we should thank them for. It feels like something that we should congratulate them for participating with us collaboratively on. And so what you have today, what we'll be presenting to you today, is the outcomes of that. It's the very start of the journey. We identified 27 different terms, and we attached definitions to those terms. We mapped what's happening already across those 28 different organisations, and that's what we're presenting to you today. So I want to hand over to the Minister at this point before I show you some of the findings from that, but I hope that gives you a flavour of what if you like, the rationale for why we're doing this and why this is important in terms of understanding what children are telling us, getting a shared understanding of what children are telling us, and equipping us to deliver the appropriate responses, the appropriate access, and the appropriate putting in place the appropriate prevention. So, Lorraine, can we play the Minister? Thank you. Lovely. Over to the Minister.
I'm pleased to speak at the launch of these valuable new guidelines for data collection on sexual violence against children. This project demonstrates the importance of creating a common language, agreed definitions, and common indicators to record and collate comparable, robust data, and the need for collaboration between organisations, both statutory and non-statutory, to achieve this. In April 2021, I launched the What Works Learning Together Fund with the aim of providing practical support to services focused on providing services for children, young people and their families, while encouraging the sharing of learning and collaboration among organisations. This project was one of the successful applications under the fund and was recognised immediately as an important piece of work, directly aligning with the objectives of the Works initiative in improving the use of data to improve outcomes for children and young people. Enhancing the availability, understanding and use of data and evidence for everyone in this sector is an important element in equipping them to do the right thing at the right time in the right way. However, the effectiveness of data collection can be hampered by a lack of shared definitions and data points as identified by the RCNI in developing this project. Different professionals using different definitions or language is a challenge to robust data collection, which in turn hinders the evidence-based responses needed. The RCNI, in collaboration with all the organisations, statutory and non-statutory, involved in this project, have taken a major step towards addressing this problem in the area of child sexual violence. My officials were pleased to be part of the consultations that contributed to the development of this guide, alongside colleagues from frontline services. TUSLA's principal focus continues to be the care and welfare of vulnerable children and families, many of whom are encountered in different contexts, such as neglect, abuse, domestic violence, and the wider remit of TUSLA services. Safety planning for children today remains at the centre of TUSLA's primary duty, and this often requires the appropriate sharing of relevant information to safeguard children. Sexual abuse referrals to TUSLA have consistently made up between 4 and 7% of all referrals. The average over the last 2 years of available data is 935 referrals a quarter. The need for evidence-informed prevention and early intervention strategies is clear. We must do all we can to anticipate problems, minimise the risks they present, and target resources at those at high risk or showing early signs of a problem. I hope that these guidelines will form part of the basis for future evidence-informed targeted intervention and prevention strategies for children at risk of sexual violence. Thank you.
And thanks to the Minister there, and I think he's really said everything we wanted to say on this in many ways. And I realised I didn't introduce our interpreters as well at the very start. Brendan, Bernadette, and Sarah. Thank you all for being here. If you have any trouble seeing them on screen, and if you need to access that service, please chat to us, and we'll assist you in any way we can. The Minister has already touched on precisely why this is important and why this guidebook will really support our collective work in this endeavour. But I just want to very briefly give you a flavour of what is in the guidance. Now, this guidance is a technical document, so it's there for continuous reference for those who are doing this work. So I'm not suggesting that in this presentation that I'm going to explain the whole thing to you in a way that we would, I suppose, with normal sort of statistical findings or anything of that nature. So this is about giving you a flavour of it. But I think the link is there in the chat. So very briefly, before I introduce the Ombudsman, let me run through some of the key issues within this document. So let me minimize myself so I can see. So in terms of developing this, one of the drivers here is that we do have international obligations around what we collect and the type of disaggregation we need. These are obligations that are based on an objective of combating child sexual violence, or sexual violence against children. And so we're very much guided by aligning ourselves both with the domestic law, the international law, and with the ambition there of not only aligning across Ireland, but aligning with internationally as well. Because the more we can do that, the more empowered we are in terms of responding. The organisations that were involved in this, just very briefly, I won't go through all of them, but what we did was we tried to identify all the organisations that are encountering these children, children who are unfortunately experiencing sexual violence. And they all participated and interrogated the definitions, and they all very generously and with a great deal of trust opened up their doors in terms of a mapping exercise to see what already existed and to see what our gaps and indeed our assumptions were, because until we shared, we weren't really clear on what our assumptions were. So I think I have covered, yeah, no, I'll just skip that. What I want to take you to is this here, and this is the mapping that we spoke about. And we looked at sort of the variables that we were required to collect under the Istanbul Convention. And the Istanbul Convention is the Council of Europe Convention we are recently enough signed up to, but we are currently starting the process of having a country review. And this convention is about preventing and combating violence against women and sexual violence. And Biljana is from the independent monitoring body, and she will be speaking to us after the Ombudsman. So a real driver in terms of definitions was those obligations. And what we mapped, for example, was that sex is one of the categories we have to collect, all of us, but actually only 7 of the 21 databases do not record the sex of the child. Now they do, some of them do record the gender of the child. And one would ask here, you might ask, because we have terminologies and definitions, and some people might ask, well, what's the difference? And why would you particularly need definitions for words that we understand the meaning of, words that are very clear to us, we use in common speech all the time. Definitions we know when we start collecting data and when we start talking to each other about what we're collecting and what we mean by these words are really, really critical. This conversation that we have across data collection actors is so critical, because until we talk to another person, we don't know that they have a slightly different understanding of that commonly used word. So the definitions are critical. And for many of the terminologies that we use, oftentimes we don't have definitions because we make assumptions about them. So the definitions are critical so that we're not making assumptions, so we're really clear on what it is we're collecting. The age of the perpetrator, and indeed the age of the child, was one of the first things we had to define, because of course that changes as well. We know from international law, and what we have established here is that anyone who is under the age of 18 is a child. However, we have other thresholds around childhood and around decision making in childhood that come in at different ages. For example, the age of sexual consent comes in at 17. So this can confuse the landscape sometimes. So again, reiterating and writing down the obvious things are really, really important to start us off. So for each of these terms, we proposed shared definitions. We looked at, in this document, and you will see the criteria for arriving at those definitions. We looked at international human rights standards, international Irish legal considerations in terms of our own domestic law here, and we looked at related terminology. The survey responses were about what we are already collecting in terms of our terms and our definitions, and how we are using the information that is available to us. Because bear in mind, when you look back at all those organizations that are part of this project, they're doing different things. So we're not looking at the child, if you like, in the same way, because we're only serving one part of that journey. We're not doing the whole. And as I said at the start, the job of the person at the front line is not to collect data. The job is a secondary task for them. So we have to recognize that in all these different locations that are delivering a different type of service at a different level to that same child, they're not going to be having the same set of data coming into them. But where we have similarities, we need to line them up and have the same words and same terminology. We came up with 27 terms here, and I will pause. And so I've already spoken about how we need to define the child in the first place. Again, we might presume this, but we absolutely need to define it, write it down, because we found, when you look at this and when you pull back the curtain here, actually some people might be counting it from 17, some from 16, but actually it's 18, and that's the shared piece. You also, and I've tripped over the language here a few times already, sexual violence against children and sexual abuse of children are two of the terms we landed on and agreed here. And you might trip over them yourself, because we're more used to speaking about child sexual violence and child sexual abuse. And the first thing that occurs to me is, well, what's the difference between sexual violence and sexual abuse? And if you refer to this document, you'll see there's actually a difference, and there's a set of definitions there that tells you the difference between what we commonly use as interchangeable terms. And the other piece about it, very importantly, is that when we looked at it, we realized that it was in fact an umbrella term, because as we unpicked some of this data about a decade ago, we began to look at the experiences of children in particular arising from the data within the RCNI database from rape crisis centres and survivors using rape crisis centres. And one of the things that we really put on the map, and that has been a focus, I think, for everyone in this space, has been the amount of children who themselves are the abusers of other children, and how we need to really pay attention to that and address that in very particular ways. And so child sexual violence, we realised, is an umbrella term for both the abusers and the victims collectively. And so if we want to be precise about who we're talking about, we need to talk about sexual violence against children and child abuse of children, as opposed to the format we're more used to. So that's one example of what got teased out in these conversations. Another piece as well that really, I suppose, and I'll jump to the very last piece, and I want to talk about two issues here. One is rape of a child. And we're very used to, in sexual violence terms, when we talk about adults, we're very used to talking about, unfortunately, the rape of adults. But what I mean by that is we often talk about rape and sexual abuse, rape and sexual assault, rape and other forms of sexual abuse. We rarely talk about the rape of children. We more often than not use the umbrella term. And I think it's for obvious reasons. It's easier for us to move that up and to not speak about those specifics of the rape of a child. But again, unless we're naming it, we may not be doing the work that we need to be doing to meet those children's needs. So again, what we found in a survey in the mapping of the existing data collection, for example, was that I think it is only five of the 16 systems that collected data in this area did not collect data on the rape of a child. And 9 of those 16 did not define it in terms of what they meant when rape was being inputted into the data system. So, it's one example where, we need to pause and think, why are we avoiding this term, and do we need to face up to it and count it? The other one I want to talk about is stalking of a child. And the reason I want to talk about that is because while we are setting down terminology and definitions here, terminology and definitions change, and that's the difficult thing to say all in the one sentence, because what we want to lock something in so that we can track it over time. That unfortunately is not how it works, and sometimes for good reasons, because we are in the business of change, we're in the business of prevention, and so we hope to change these categories. Stalking is a good example, because only, was it last week, the Minister for Justice promised new legislation on stalking. We are future-proof to some extent here in terms of a definition and terminology around stalking, and we would hope that this guidance is referred to by those who are currently drafting that piece of legislation. But when that legislation arrives, it will be new law in Ireland, and we will have to check if this terminology matches that new law and review as needed in that. So this is an electronic document, it is a living document. So I hope that gives you a flavour of what's in here. We're very clear that this is the start of a process. We have only got 27 terms there. We know there's a vast array of terminology and definitions that we need to clarify around sexual violence against children online. We also need to do the same piece of work around adult sexual violence. So there's a lot more work to be done here. And it is, of course, as I say, a living piece of work in terms of keeping these live, and in terms of keeping everyone who's in the business of inputting data alive to this shared meaning and this shared language that we have established here. So without much more from me, I want to hand you over to the Ombudsman for Children, who has been a campaigner on the issue of the gaps in data around child sexual violence for very, very many years. So very welcome, and thank you very much for being with us.
Thank you very much, Cliona. Can you hear me okay? Okay. very much honoured to be here, delighted to be part of this launch today. It's a hugely important piece of work. Cliona has outlined it very, very well. But first of all, I want to just give thanks to Cliona and to Elaine Mears and Helen Bartlett as well for the amount of work they've done on this. And you can already hear the real depth of the volume of work that's been done. It's hugely important, very impressive piece of work. And again, from my point of view as children's rights, you know, we've been working towards the protection of children's rights, and Article 19 is very clear that we have a statutory obligation under the UN Convention on the Rights of the Child to protect children from all forms of physical and mental abuse or mental violence. And this is really a huge step forward. And congratulations to Cliona and Elaine again. I know their passion for this work for the last 10, 15 years, since before I was Ombudsman for Children. And all of us here today have a common goal in seeking to protect the rights of children and to advocate for their welfare. And as anyone that works in the provision of services to children at any level will know, language matters, words matter. What also matters is the availability of reliable, comparable data from across all those agencies working to protect children, which I believe will be significantly enhanced through having a shared and consistent set of definitions and terminology. And these guidelines state, and I quote, more comprehensive the picture of violence against the child, the more comprehensive the advocacy, protection, and interagency supports can be, end quote. And this is vital because for me as Ombudsman, I have regularly criticised the government for the lack of data in many areas and how that is then used to avoid making decisions which can benefit children in the long run. So again, great credit to the Learning Together, the What Works Fund from the Department of Children for funding this and backing this. It's going to be hugely important going forward. At the heart of what's being launched today is a desire to facilitate the clearest and fullest representation possible of the levels and types of violence against children in order to deliver, in turn, the best possible responses from service level on the ground right up to policy and legislative decision-making levels. Having a coherent and agreed language will also go a very long way to improving our aim of prevention, because it means that parents, schools, clubs, youth groups, etc., can begin the process of socializing children via appropriate language. It would leave much less room for interpretation or misunderstanding around what is meant by the language used in these scenarios. A shared and consistent set of definitions and terminology is not only for the data collectors, but can be the tools with which communication improves across the whole generation and maybe even between generations in the future. This shared understanding is needed now more than ever, as the long overdue conversations around consent and educating young people and society are finally taking place. We need to teach our young people how to interact in a respectful and safe way. A common language is vital for those conversations to be successful. I was honoured to have been invited to speak at the launch of the RCNI's Storm and Stress report last summer on the exploration of sexual harassment among adolescents, which highlighted some really shocking figures. I mentioned then that sunlight is said to be the best disinfectant, and therefore it's only by having a clear, robust data that we can start to shine that light. And I think this is going to help that enormously. We're going to have really clear, precise data, and that's the sunlight that will shine on our children's real issues and know exactly what we need to fix. To quote from the UN Human Rights Office of Interagency working about terminology, in 2016, they said, words matter because they affect how we conceptualize problems, prioritize issues, and forge responses. Inconsistent use of language and terms can lead to inconsistent laws and policy responses on the same issues. And we see that all across Ireland, many different ways of dealing with the same thing, the same issue, across different departments and different public services. Today's launch is also timely, coming just a couple of weeks after Senator Eileen Flynn introduced a new bill seeking to remove any references to the term child pornography from existing legislation and replace it with the term child sexual exploitation material. As she said in the Senate, it's our job to protect children in this country. We must listen to them regarding their experiences and do what we can to support children and victims. We must start that by labeling what they want through correctly calling it child exploitation. And that's something that our office has been looking for some time now, recommending in our advice on the general scheme of the Criminal Law Sexual Offences Bill back in 2015. We said that the child pornography needed to be amended to a term that more accurately reflects the grave nature of the content. And I think we're certainly moving in that direction at the government level. Reports that the government will not oppose this bill from Senator Flynn are to be welcomed. The rapid rise in technology, compounding the digital dimension of sexual violence against children, as referenced in this report, highlights how crucial it is to be vigilant in this space too, and the inherent need for children to be safe online. As the guideline states, I'm going to quote again, terminology around sexual violence is evolving, particularly where there is a digital or online element, meaning that clear guidelines and definitions are required by staff. So that constant changing of terminology, it's a way for many adults to avoid being caught by using different terminology. And it's something we need to get a handle with on as quickly as possible. And this guideline moves in that direction. Gandhi said, your beliefs become your thoughts become your words become your actions become your habits become your values, and your values become your destiny. And that's crucial when we think of what we're doing today. Words, and forgive me, I'm going to use some very terrible old terms that were used over the time. Terms like imbecile and lunatic were used in our legislation. Mongoloid, illegitimate, the N-word, pauper, harlot, poof, queer. These terms were derogatory terms for some of the most vulnerable children and individuals in our society. These terms facilitated some human beings who wanted to separate themselves from those who we are not the same. It is how we begin to other people. When we as a society begin othering people, we are setting up a ready-made excuse or justification for poor treatment of those people in the future, thus sowing the seeds for the concept of them and us. That well-known dichotomy which has torn so many civilizations apart over the course of human existence. And we cannot deny, especially here in Ireland, that for centuries, children across the world and here have, up until relatively recently, been seen as them or others by so many parts of our society, thereby allowing the most unspeakable horrors to be visited upon them because they are not like us. I just want to remind you of a couple of examples of legal supports for child abuse that were still in place in Ireland as recently as 2015 when I started in this job. At that stage, we allowed within the legal system the justified corporal punishment of children within the family under the term reasonable chastisement. We also justified and allowed, under application to the courts, early marriages or child brides. We are not so far away from them and us. We need to move further. And breaking the silence clearly states a fact that is not highlighted enough and something that we need to counter very strongly in the othering of children. It says, and I quote, "No violence against children is justifiable and all violence against children is preventable." And that's the piece we need to jump on, is the prevention. We all need to sing that from the rooftops so that people recognize that how they speak about children, how they understand the words they use, and as Gandhi said, the actions that come from those words can be positive or negative influence across the whole of society. We all need to begin to use the words and definitions laid out here so that we can better support our children, and just as importantly, begin to limit the power of those who use the language to hurt children. The importance of how we define abuse in both legislation and everyday life can never, in my view, be overstated. If we are all on the same page in terms of terminology we use with a shared set of definitions, the outcomes achieved, I believe, will be greatly improved. Thank you to the RCNI for inviting me to speak today, and congratulations again on a fantastic piece of work. And I hope that all the agencies here get to use it and spread the word as quickly as possible. Thank you very much.
Thank you very much, Ombudsman, and my apologies, I reversed the order of speakers there, so I hope I didn't catch you on the hop. You stepped right up. So without further ado, let me introduce our friend and our colleague and an expert in this field that we are absolutely delighted is coming to us today. She is coming to us, I think you're probably in Serbia today. Biljana has been is sitting on the independent monitoring committee of the Istanbul Convention. She has monitored a number of different countries across Europe. She has much experience in this. And I think one of the common feedbacks to all countries under examination in terms of compliance with this international standard is when it comes to data that we must do better. I think that's common to all of us. I think possibly as it's Ireland's turn right now, I think the report will probably, I predict, say Ireland must do better, but I hope that it will say that we're on the right path. So if I can hand it over for reflections from Biljana, which may give us a precursor to what we might expect from the examination from the Grevio Committee. Thank you, Biljana.
Thank you so much. Just a few words about me. I have worked a lot on the issue of sexual violence. I conducted the first prevalence survey on sexual violence against adolescents in my country, which was later replicated in all countries of Western Balkans. I'm a researcher and consultant, and I work for UN agencies, European Parliament, Council of Europe, European Commission, you name it. First of all, I want to say that I welcome the initiative of Rape Crisis Network because in our baseline evaluation reports, we as Grevio very often recommend that the data categories in use in data collection systems should be harmonized across the various sectors. I cannot comment on specific definitions that are suggested in this initiative, but I appreciate the effort to establish common definitions. I heard that Ireland is currently developing a new national action plan, so I would suggest you to consider including this initiative into the national action plan. Going back to explanation of the Article 11 of the Convention, which deals with data collection and research, my first point is that when explaining this article, it is helpful to start with its purpose, which is evidence-based policy making. Data collection and research are tools that should be used by state parties to identify gaps in the implementation of laws and policies, to measure countries' progress in meeting the obligations specified in the Convention, and guide policy making to create proposals for improving the legislation, its application, and to revise the policies. To simplify a little, if the provisions contained in Article 11 are not implemented properly, it becomes difficult to assess whether the Convention as a whole is implemented properly, and that is why data collection and research are so important. The second point I want to make, requirements related to data collection should be viewed within a wider framework of the Convention, and all efforts in this regard should be undertaken taking into account Articles 6 and 7. And let me remind you of these articles. The Convention reaffirms gendered understanding of violence against women, and a clear gender dimension overlaps its various provisions. Article 6 requires parties to ensure a gender perspective is applied not only when designing measures, but also when evaluating their impact. Therefore, a gender impact assessment should be carried out in the planning stage of any measure. Further, in the evaluation stage, it should be determined whether there is a gender differential in the impact of the provisions. It is self-evident that a possible gender differential in the impact cannot be determined without sex disaggregated data. Secondly, Article 7 implies that parties are required to establish a comprehensive policy response along all four pillars of the Convention: prevention, protection, prosecution, and integrated policies, which means to create comprehensive and coordinated policies sustained by the necessary institutional, financial, and organizational structures. So when you are developing a new national action plan now, I would like to inspire you to think, have you developed equally strong measures across pillars of the Convention? Are measures related to protection complementary or contradictory to measures related to persecution? I'm saying this because I found such examples in many countries that I analyzed so far. I would like to go back to this issue in a discussion, but just let me ask one question on this point. As far as I know, Ireland is doing very well when it comes to specialist service provision to sexual abuse victims. The question is, did you meet the requirement related to number of services, which is one sexual violence referral center or rape crisis center per 200,000 inhabitants? So far, we found only one country, that's Denmark, which met this recommended standard. In the process of developing the National Action Plan, and also because soon you will be evaluated by Grevio, I would like you to suggest to you to use one useful recent source. That's midterm horizontal review of Grevio baseline evaluation reports. You can find examples of good and bad practice in data collection there, and I will mention a few in this presentation. Finally, I would like to stress that Article 11 should be read in conjunction with Article 10, which specifies that one of the roles of the national coordinating body is to coordinate data collection, analysis, and dissemination of data. So my question is this already included as one of the tasks of the national coordinating body in Ireland? Going back to explanation of the requirements of Article 11, first of all, I should explain that paragraph 1A includes an obligation to systematically, at regular intervals, collect statistical data on all forms of violence covered by the Convention, and that includes administrative data compiled by healthcare, social welfare services, law enforcement, specialist services, as well as judicial data recorded by prosecutors and courts. Here I want to add that in some Grevio reports, we clarified that this requirement to collect data applies to those women and women's NGOs that are publicly funded. In order to build up comprehensive data collection systems that can serve a wider purpose of designing and evaluating policies, as I explained, it's crucial to set up comparable data categories, and that's why I welcome this initiative. Data collection system in different state agencies should go beyond internal recording purposes, and data categories in use should be harmonized across the various sectors, especially law enforcement, prosecutors, and judiciary. Grevio also often emphasizes that it should be possible to track cases from reporting to indictment and beyond across the various stages in the criminal justice chain in relation to all criminal offenses required by the Convention, and to identify outcome of cases. Further, in line with Article 11, all recorded data should be disaggregated by sex and age of both the victim and the perpetrator, the relationship between them, type of violence, and geographical location, as well as other factors deemed relevant, such as disability. Article 11, paragraph 1b requires to conduct research on all forms of violence covered by the Convention, including research on root causes and consequences of violence, incidents, conviction rates, as well as the efficiency of measures taken to implement the Convention. There are huge problems in this area. Paragraph 2 further specifies that parties should conduct population-based surveys on prevalence of all forms of violence covered by the Convention in regular intervals, so the changes over time can be examined. Paragraph 3 of this article includes the obligation to provide Grevio with the information provided by different data collection systems in order to stimulate international cooperation and enable international benchmarking. Ireland will be involved in this process relatively soon. Paragraph 4 requires that the information collected should be available to public, and while doing so, parties should pay attention to the privacy rights of persons affected. This means that the data for public use should be anonymized, that individuals should not be identifiable. We as Grevio repeatedly recommended that parties should ensure that when they are analyzing or storing personal data, they should comply with the standards included in another Council of Europe convention, which is called Council of Europe Convention for the Protection of Individuals with regard to automatic processing of personal data. Let me give you a few examples of this provision. In report on Italy, we found problems related to protection of personal data of the victims. In certain regions of Italy, the authorities developed criteria for local funding of specialist services. In Italy, they're called anti-violence centers. And the regional authorities asked the centers to provide victims' personal data, their fiscal codes, as a condition to continue funding. The explanation was that the authorities want to monitor incidents of violence against women and to analyze activities of these centers. We strongly criticize this practice, and we often, and including in this report on Italy, we recommended to the authorities to comply with standards of personal data protection and to respect working methods of specialist services, which grant victims privacy and confidential disclosing of their experiences. We also clarified specific standards in this area, which are: unauthorized access to personal data should not be possible. All participating agencies should follow clearly defined protocols regulating procedures for data sharing. Full anonymity should be granted to persons whose personal data have been registered, including the requirement that such data should not be shared without their informed consent, and individuals should not be identifiable through data that are available to public. Similar considerations are provided in our report on Turkey. In Serbia, we strongly criticize the practice of the National Helpline, which records the calls digitally. And the authorities explained that these recordings are made only for the case that the victim wants to initiate legal action, and that calls will be released only to the court on the special request of the court. But of course, we criticize that practice for the reasons that I just explained. Let me now give you a few promising practice examples in the area of data collection. We praised Portuguese authorities for introducing the obligation to collate data from law enforcement and judiciary so as to reconstruct the entire criminal proceedings chain from the filing of the report or the complaint to the law enforcement to the delivery of the judgment by the court. This is crucial. In Spain, we commended the authorities for their data collection on intimate partner violence against women. As an example, National Police Statistics Service collects data which is disaggregated by sex, age, type of crime, relationship with the victim, location, province, and other significant details. In Sweden, we took a positive note of collection of data on FGM, female genital mutilation, by healthcare services, including codes indicating pregnancy complicated by FGM. With respect to evidence-based policy making through supporting research, we commended Sweden for their leading role in policy making. We especially were impressed by the fact that they have a research center which is dedicated exclusively to the study of men's violence against women. Similar considerations were provided in our reports on Spain, France, and Belgium with respect to evidence-based policy making. Now going to explain a few typical shortcomings related to data collection that are probably relevant to your country as well. I'm sorry to say, but parties that fully comply with the requirement to disaggregate data by all categories required by the Article 11 are rare. Weaknesses are present even in countries that are well known for their achievements in gender statistics. On this point, I have to say that I read a survey conducted by Rape Crisis Network, and I was surprised by the fact that some entities or organizations do not disaggregate data by sex of both the victim and the perpetrator and their relationship. To give you examples, in many parties, including Belgium, Denmark, Malta, Monaco, Montenegro, the Netherlands, we identified that sex disaggregated data on victims or perpetrators is not collected by criminal justice sector. In particular, there is a problem with recording the victim-perpetrator relationship, and this information is absent in administrative or judicial data in many countries, including Albania, Belgium, Denmark, Finland, Italy, with some exceptions, Malta, Montenegro, the Netherlands, Poland, France, with some exceptions, or the categories used by law enforcement or judiciary are too broad to capture the actual nature of the relationship. This is the case in Sweden, Finland, and Austria. As an example, categories used in Sweden are acquainted with the victim, not acquainted with the victim, together with categories indoors, outdoors. This is helpful to some extent, but it's not specific enough. So we often recommend it to many parties to develop data categories on the victim-offender relationship for all forms of violence against women that would allow the nature of the relationship to be more specifically documented. This is something which is addressed in the Rape Crisis Network document. In Andorra, Denmark, Italy, and Malta, we noted a lack of data on child victims and witnesses. In particular, there is a problem whether courts, when they are deciding on custody and visitation, take into account histories of domestic violence. I don't know if this is covered in your practice of data collection or not. If not, I would suggest to include this issue. In the majority of the parties, there is no harmonization of categories used by institutions in criminal justice sector, law enforcement, prosecution, and courts, and it is not possible to track cases from reporting to final judgment by the court. So we, as Grevio, repeatedly stressed that an important element of harmonization is the use of common definitions and units of measurement. We also found that data collection on different measures that fall under protection is underdeveloped. As an example, data on access of victims to healthcare is limited to domestic violence or is absent in many parties. In some parties, including Andorra, Malta, Portugal, Serbia, and Spain, administrative data collection is limited to domestic violence, and other forms of violence are less covered. My final point example is related to attrition, but I would like to leave it for a discussion. I would like to go back to my previous point on inconsistency of measures across different pillars of the convention, and how analysis of attrition should be included in national action plans, but we can leave it for a discussion which I'm hoping that we will have later.
Thank you so very much, Biljana. Really appreciate that. And you raise lots of really critical questions for us, particularly because we are in development here. We are still very much in development. There's still a lot of things that we haven't got right and that we're working on. And of course, one of the things that is clear to us is that none of these things can happen quickly, because there are so many considerations, and you put one thing in place and it can knock something else off. It can have unintended consequences. And for example, your example of Italy there, you know, the most of these initiatives are put in place with very good intentions of compliance.
Yes.
But then of course there are consequences. And for us, in terms of rape crisis, we continually keep our eye on the access of survivors to centres. That is the most important thing, and how they experience and how they can access, and how our work in collecting data may impact that, and how we can minimise or prevent that from happening. You raise, and I would invite anyone to write into chat. We have a few more minutes here if they would like to ask any of the panelists a question. But you raise the issue of the courts, the criminal courts and the civil courts, and how we track that. I think that is one of the biggest questions we have that we're trying to unpick at the moment. And I imagine, and I know that our international, we're not alone in this. This is international as well. And we certainly have a coalition of NGOs in the children's, domestic violence and sexual violence sectors who are trying to understand that pathway of domestic and sexual violence from the criminal through to the civil, private and public civil courts and family courts. And one of the key questions is how we collect the data. One of the first things we did as a collective of NGOs was we said, let's pool our data so that we can understand and we can jigsaw puzzle together the journey of the child, and how child sexual violence, for example, might get lost in that picture. And of course, what we found when we pooled our data was our data didn't use the same terminology, so it couldn't speak to, you know, so we needed to go back a step. So I suppose I think one of the things that you've highlighted here is how this is a long journey, and I think this piece, breaking the silence, is for us a very first step. It's an important step, and some I think the Ombudsman used much stronger words, and the Minister indeed, on just how vital this step is vital, but it's also, we have to understand, a first and careful step to build up something, and it has to be done collaboratively with all of us. I would invite, would the panelists like to say some concluding comments before we finish out? I have promised that this will be finished, that we'll be up in an hour, so I have a minute for everyone to come in. Niall, would you like to come in there? Thank you. Would you like to?
Listen, I think Biljana put a fantastic piece there about how the international context is going to be crucial, that we follow it and we take some of the ideas that she's put forward. And I hope the senior civil servants are listening to what's needed. But I think your work is a huge contribution to a good start. I think that's probably the way, and I thank you again for that.
And I suppose just to round off, I would like to, and we have mentioned the names, but really just thank the people who led up this project for us, Elaine Mears and Helen Bartlett here, and who many of you here will be familiar with from their work collaboration with all of you and leading on this project. So thank you again for your amazing work in this area, and we hope much more work and the continued work and building on this beginning. So thank you all very much. Thank you, Biljana. Thank you now.